Excuse me. Hello there. My name is Dr. Satori, and I will be filling in for your regular doctor today. I hope that's all right. You look a little bit nervous. Can I ask your name first and foremost? Nice to meet you. I understand many patients get very stressed when they find out that the doctor who knows and understands them is not currently available. I promise to make this as relaxing and simple and as comfortable as I can. I am the registered doctor around the local hospital. Usually I work with patients who suffer from heart-related issues and things like that, but I also have training in just regular checkups and everything, or else I would not have my degree. Have you been through a cranial nerve examination before? Okay, so that's good. I'm just going to go through your chart here and get a little bit of information on you, verify that it is correct. I won't make it long. I understand your regular doctor probably would already know this, but I promise I'm one with compassion. Okay, so you verified your name for me. Could you just verify your phone number and address for me, please? Okay, that seems to have changed. Could you give me your update? Thank you. Okay. Brilliant. Okay, that's great. Let's see. Any new medications? Okay. Any updated allergies I should be aware of? Okay. Anything different that overall? Okay. And what is the reason of your cranial nerve examination today? Good. Thank you. You're great. See? That wasn't so bad, was it? Okay, so I am just going to go ahead and get a heartbeat on you, a blood pressure, and a temp, and then we can begin. So, just to go over what the cranial nerve examination entails, I am going to be checking all of your nerves on your face. I'm going to be making sure everything is working properly, from your thoughts to your vision to your feeling of touch. All 5 senses I'm going to be going over with you today. But before I start, I like to ask all of my patients for consent just to touch them, to make it a little bit more personable. These days, it's almost as if patients are viewed as a number, and sometimes patients with serious illnesses, have to act like they're okay in front of their doctors in fear of being judged. And I just want to make sure that if anything is hurting you, that you let me know, and I will avoid that area as best as possible, and we can work towards a just comfortable cranial nerve examination today. Thank you. Excellent. Okay, so let's just start off with a beat. Okay, I'm just gonna put this on your chest right here. If you could do me a favor, just breathe in. Take a deep breath. Deep. Go on. Yep. Exhale. Okay. Over here. Deep breath. Best you can do. Don't feel pressured. Okay. Exhale for me. There you go. I'm just going to move around to your backside here. If I could have you just lean forward to me. That's good. Very good. Okay. Good. And one more for me. Exhale for me. Good. Okay, everything seems to be working properly in that respect. Now I'm just going to go ahead and get a blood pressure on you. So nowadays, since you are in this office today, usually you would be in your regular doctor's office, or this is usually where you go. Okay, they do the electronic blood pressure on you, but I'm kind of a classic old-fashioned doctor. I like to take things very personal. Both ways there, but I just want to do it right. Computers can be wrong. That's the problem we have nowadays that doctors don't seem to address. If you give the wrong diagnosis, it's a problem. So with me, you don't have to worry. Let's go ahead and tie this here. Okay, I'm just going to need you to slip your arm through here. Good. Okay, and I'm just going to go ahead and get blood pressure. Okay, here we go. Okay. Have you slip your arm out of it? Excellent. Okay. Blood pressure is in normal range. No problem there. Okay. Next, I'm just going to get a quick temperature. Now this one does work. It is within the date, so these things are rarely wrong, but I'm just going to swipe it across your forehead. Ready? Okay. Perfect. Okay. So now we are ready to start the cranial nerve exam, and before I put on gloves, I'm just going to press against your face. I did sanitize my hands prior to coming in the room. All doctors must do that. So all I need you to do is just sit shoulders up, relaxed of course, and I'm just going to go ahead and get a feel for your face and your neck. I'm going to be checking your lymph nodes, which are right below the jaw by the ears, and I'm going to make sure they are not swollen. We're going to do, again, the five. We're going to do the five senses: taste, touch, smell, hearing, and something else that I cannot think of at the moment, but get started on that. So let me just get up close. Okay. And I'm just feeling right now around your lymph nodes, kind of giving a massage, if you will, if you can feel that. I'm going to get a little bit tense with you. Pressing a little hard. I'm not feeling the lymph nodes on you. Have you ever had your tonsils removed? Okay, so that could potentially be why, but overall, if there's not a lump there, there's nothing to be worried about. So that's good. Let's see. Okay. I'm just gonna actually start with taste first. So what I'm gonna do is I'm gonna take this tongue depressor and I'm gonna have you open your mouth and say, ah. You've probably done it before. I'm just going to get a good look with this pin light and check and make sure that your throat's not swollen, because if you are, without your tonsils, I would not be able to feel that or view that, okay? I'm just going to get a good look in your mouth, make sure everything is within range. Okay, ready? All right, go ahead and open your mouth and say, ah. Good. Go ahead and tilt your head back for me. Thank you. Very good. Doing great. I'm just going to put this right on your tongue. Okay. Okay. Excellent. Set that over there. So nothing looks swollen. Everything seems in order. I'm going to do a quick taste test on you. That just makes sure you can taste the difference of certain things. If everything is in order, you will know this taste right away. I checked your chart, so you can have these things. No worries. Can't tell you what they are. So I have them hidden here in my hands. And I'm just going to have you, if you would, just close. Just close your eyes. Okay? And go ahead and just say, ah, again. We'll try the first. Ready? Go ahead and give it a taste. What do you think it is? Very good. Salt. Okay. And next, go ahead and just close your eyes again. Just close them. Just close. Your eyes. Here we go. Go ahead. Lift your chin up. Open up and say, ah. Okay. Good shut now. What do you think? Pepper. Very good. So, there is nothing wrong with your taste. We have felt your lymph nodes. We've given the throat a nice feel to make sure that there are no lumps. You have nothing to be concerned about in the tasting area. And now I'm going to go ahead and put on my gloves, because we are now going to go with the full touching followed by vision. So I just have some gloves here. And I'm just going to apply them. And we're going to do the touching test, sensory test. I'm going to have you do a few things before I actually touch your face. I'm going to have you, if you would, when I say go, pretty much, to raise your eyebrows. You don't have to do that right now, but just preparing you for the next test. Okay. So, how has your day been? Yeah? That's good to hear. How do you feel about the weather outside these days? I know, I'm such a rainy day type person. I just love when it rains. I don't know. I love when it's snowy and you're kind of forced to feel like cozied in and comfortable and safe and sleepy. I love things like that, but okay. Had to waste some few moments there, but again, before I touch you, could you do me a favor and raise your eyebrows for me? It's a little bit hard for me. Okay? Go ahead, raise them up again for me. Good. Okay, this might seem a little bit silly, but could you hold your nose and blow? Go. Go ahead. Same as I'm doing it. Very good. Okay, could you go like this? I know, it's very silly. Very good. Could you make a kissy face for me? Very dramatic, yes. Could you stick your tongue to each side of your cheek? 1, 2. And could you smile very big for me? As big as you can get it, as cheesy as you can, as if you're winning an award you don't care about. There you go. And now could you frown? Make a squinty face for me? Very good. Thank you so much. Now we can begin the touching. Regarding the muscles in your face, there is no drooping, which is no signs of a stroke. So that is very good. Even for your age, that is not likely, but at the same time, anything could happen to anybody. So what I'm going to do is I'm just going to gently feel your temples, just move around your face, and I just want you to let me know if my pressure becomes harder, more intense, or just kind of gentle touching on each side. So for example, if I'm pressing on this side very intensely or intense, and I'm just gently touching light on this side, let me know if there is a difference, okay? Good. Okay, so it's going to start up here with a massage on your temples. You're not going to find any difference here. Okay? Making sure there's no swelling, no lumps, nothing to be concerned about. Then we're just going to move down, and now I want you to tell me if there's any difference in the way that I'm touching your face, okay? Very good. Yes, okay. Okay, yes, it's the same. Very good. And one more time. Very good. Okay, so reactions are good, but we're still gonna test that just to make sure. I have a little manicure pin here, a manicure pin. I have a manicure pin here, and what I'm going to be doing is I'm just going to be getting up close to you, and I'm just going to be pressing a side of your face or just gentle areas to make sure that your reaction to touch is the same and accurate, okay? Good. So, all I need you to do is keep your eyes on me and just straight at me and let me know when you feel something, okay? Just keep looking directly at me. Good. Okay. Directly at me, let me know when you feel a touch. Good. A touch, a touch. Let me know when you feel one. A touch, a touch. Good. Let me know when you feel a touch. Just a touch. Let me know. Good. And let's try it one more time. Very good. Okay. That was almost too easy. So now I'm going to bring in 2, count them, 2 sticks. Okay. Good. Let me know if it's once or twice. Very good. Keep your eyes directly on me. Okay. Very good. That was a little too easy, but if it was serious, you would not be able to feel both sides. Judging by the strength of your face with your muscles, the way you smile, squint, whatever you're doing, it's in normal range. So now I'm just going to take this brush. I'm just going to brush different parts of your face very gently. Very, very gently. There is no test to this one. I just want you to let me know when you feel it. Okay. Just let me know when you feel something. Very good. Okay. Very good. Very gently. Very good. Then one more time. Too easy, but you passed very well. Okay, so next, while I have my gloves on, we're going to do sight, and then we'll move on to hearing and smell. Okay, so with your sight, as you can see, the eye test in the background, and I have a colorblind test, but first I want to make sure that I just go ahead and give a quick look into your eyes to make sure that everything's working properly. No appearance of a detached retina, which is probably the most serious thing that could happen, but I do have to ask, have you been seeing any fuzzy white things in your vision? Any dots? When you stand up, do you see black almost? Well, if you're standing up and seeing black, that's a sign of dehydration and high blood pressure, but if you are seeing like white lights or fuzzies in your field of vision, you should get that checked out by an optometrist immediately. That could represent a detached retina. But we're going to look and make sure, judging by me looking at you with your beautiful eyes, by the way, you seem to have no swelling. One eye doesn't look larger than the other. Okay, here we go. I'm just going to peer up into your eye here. Lift up your right eyelid. Okay. Lifting up your lid. Good. And down. Just down, down. Okay. Good. And your left eye now. Okay, lift up here. Sorry if I seem to be bumping you a little bit. Good. And your lower lid. Excellent. So what we're going to do before we begin the vision and the colorblind test is I'm going to be sitting back here. And I guess technically there is no longer any touching physically of your eyes or anything of the sort. So we're going to do the field vision test, which is where just let me know where my fingers are coming in and just follow them and let me know left or right, okay? Get a little bit back. Alright, ready? Just follow my fingers first. Tell me which way they're coming in. Good. Follow them. It's almost like a DVD screenplay or screensaver. Oh, it just keeps bouncing off the walls. And you're wondering why your mother hasn't changed the DVD for you yet, because you're too young, or you put it in and your burnt CD does not work in the DVD player. Very good. Now we're going to do the exact same thing, only I just need you to keep directly on my eyes. So I'm just going to be moving my hands in and out of your field of vision, only you're going to keep directly at my eyes. And what this shows is to make sure you do not have a lazy eye. If you did have signs of a lazy eye, you would kind of always try to focus, but at the same time kind of move around not focused, if I'm making sense with that. But just keep directly on my eyes. Ready? Do not look away, please. Good. Good. If you can notice, still staring directly at my eyes, you're doing very good. I'm kind of doing a manipulation tactic here where it appears I'm going to be using my arm and I come in with the other one, and that is a form of vision direction, which ultimately would bring your eyes to focus on the opposite of what I am telling you to do. For your sake, you did very well and did not flinch once, so thank you very much. You have passed that section of our test. Now we are going to do the simple vision test. We're just going to see how well your eyes appear to be. Now, this is such a classic form of testing your vision. It appears there are so many different things these days, like LASIK or, eye surgeries to help you see better, but ultimately, to find out what your prescription is, it's always remained the same. So, all I need you to do now is tell me what the smallest line you can read is, or what you think you can read. And go ahead and read the letters for me. Okay. 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 Go on. And okay. Okay, why don't you do me a favor and try to read line 5 for me? Which one's this? Okay. Okay, so you got that one. Line 7, you got the letters L and C wrong. But let's try line 6 to meet in the middle, kind of. Okay. Good. Okay. Okay. And okay, so line 6, the only letter that you did get wrong was C. It was meant to be an O, but we're just gonna go, and I'm just gonna cover your eye, and you're gonna just go ahead and read this again. We're gonna cover your right eye. Could you read line 7 for me again? Okay. And let's just try the left eye here. Okay, could you go ahead and read line 5 again for me? Okay. Okay, good. So it appears, just judging, because I am not qualified to give a diagnosis, but I'd probably, if I were you, call your optometrist just to get an updated eye checkup. There's nothing serious I see wrong or any legally blindness or anything like that. Nothing to be concerned about, but I would like you to get an updated check. Missing 1 or 2 is a completely normal thing, but it's just always good to make sure you are well on your vision. As you can see, I have very large lenses. My prescription is -8 and -10 on my left eye. Yes, my left eye is -10 and my right eye is -8. I am legally blind without my glasses. Although I would rather be legally blonde, but that's okay. So let's go ahead with our colorblind test. Okay, start. Can you read this number for me, please? Very good. What about this? Very good. And this one? Very good. And how about this one? Excellent. And this? Okay. Okay. Let's just move that one over. And this one? Good. And this one. Very good. Okay, so which one? Right here. The only reason I'm going to let this one slide with your vision is because whenever it was printed, we were low on ink. So I always kind of give everybody a pass with this as long as they did not miss any other ones. Let me see here. You got this one, so we're good. Yes, you did pass all the vision tests. Again, I would just hope that you just call and make a checkup with your optometrist. But the last thing that we have to do here is your nose. We've went over the touch. We've went over your... Oh, nope, we did not go over your hearing yet. So let's just go ahead and get smell out of the way and we'll finish up with your hearing, okay? Excellent. So, all I'm going to need you to do is lift your head up and I'm going to go ahead and look into your nose cavity. Go ahead. Okay, here we go. Just going to go ahead and touch the tip of your nose here and lift up. Okay. Okay. Unlike myself, you seem to be fine in regards to natural snot. And now we're going to do the smell test. And I just would like you to let me know what this smells like. But yes, your snot production is normal. Okay, that's the correct one. Go ahead and give this a smell for me, a whiff. Go ahead. And what do you think that smells like? Citrus, I'll let it pass. Oranges. Very good. Followed by this one. Go ahead and give it a smell. Now this one I'll let slide no matter probably what you smell, as long as you can smell the... Go ahead. Strawberries, that'll work. Most people can sense a taste of like bitterness just from your scent because your taste and your scent is the same. Your taste buds are technically your smell. Most people will say, oh, this tastes like sunscreen. And they're like, what do you mean this tastes like sunscreen? Their brain is trying to say that it tastes of the smell of sunscreen. So it's very similar. The brain gets it messed up. The only time that there would be a problem is if you just couldn't really make up a general definition of a smell that we have here, such as bitter or sweet. So you have passed the smell test, which leaves us with our hearing. That is the only thing we have left. And I have a electronic test here with earbuds, and I have a test with just regular hands and mouth. So I'm just going to get these up close in your ears. Good. Okay. Now I just need you to tell me which ear you are hearing from, okay? Ready? Did you hear something? Oh, yeah, just let me know when you hear a sound. Yes, you'll hear it in the earbuds. It's kind of like a clicking motion. Okay? Again? Anytime you hear it. Very good. Okay. Very good. I'll let that one pass. I know this test by heart. Okay. Very good. Okay. So, you got both right. The only one you were a little bit iffy on, which is completely okay, is the center one, which the earphones are a little bit old, so that's why we kind of do both, where I'm going to now use my hands. So I'm just going to get super close to your ears here, and I just want you to let me know when you hear a sound, okay? Which ear did you hear that out of? Very good. Very good. Okay. Am I very good? Am I counting to 2? Just go ahead, go along. Okay, the crystal is selenite. Very good. Do you like tomatoes? Very good. So, you have passed hearing tests, but the last thing I'm going to do is I'm just going to give a look in your right ear, just for the fact that you were a little bit iffy on answering, but nothing to be concerned about. To be completely honest, you have passed every single panel of this test, so congratulations. Nothing to be concerned about. Just again, call for a yearly checkup for your eyes. We all need it. Some people wait too long, and then the prescription is more expensive. Once it comes, take it from me who's went through it, but I'm just gonna get over here and just give you a nice look-see your ear. Just go ahead and turn your head for me. Keep it that way. I'm just looking in your right ear cavity. Okay. And pull up on your ear here. Okay. Nope. You seem to be doing fine. Just pressing. Okay, can you turn your head the other way for me? I'm gonna just look in this ear as well to make sure. Okay. Lift up here. Good. Okay, just press on this one. You did great. Absolutely. 100% passed, so I'm just going to go ahead and write in here. But other than that, that is it for your cranial nerve examination today. Do me a favor. Just writing down your findings. Your temp was good. Blood pressure. Your heartbeat, heart rate. Vision. Okay. Your hearing, good. Your smell, great. Taste good, and touch very well. So overall, that was pretty much your yearly checkup. Go ahead and take this updated chart to the front for me. It was very, very nice meeting you, and I will see you next time. Have a safe trip home, and I'll see you soon. Bye.